that. Hold on, we all have to press that button, right? Okay. Okay. All right, well, welcome. Thanks for coming, everyone, and joining us. Smiles in the Classroom and ADEA and Planet Smilez are really excited to come and kind of have this conversation with you all, share a little bit about the pathway and also the profession. I'm really fortunate. I am not a dentist. My background's in higher education, student affairs, and I have brought three amazing dental professionals with me that are going to support this presentation. So we're going to go ahead and just get started with some introductions. Like I said, I'm Curtis Burrill. I've been with ADEA, the American Dental Education Association, for almost 3 years now. We are the organization that represents all of the dental schools in the US and Canada, North America. And my position specifically is working on pathway programs for middle, high school, college students to find their way into the dental profession. Catherine, do you want to introduce yourself?
Hi, it's really nice to be here. I'd like to introduce myself. My name is Dr. Catherine Pollack, and I'm a board certified pediatric dentist with a strong passion for dental education and public health advocacy. I'm the founder of Planet Smilez, which is a nonprofit organization dedicated to empowering youth in underrepresented communities through dental education and mentorship. So it's a really big pleasure to be here with you all today. And I'd like to introduce you to two of our Planet Smilez team members, Dr. Shargel and Dr. Gritzer. So Dr. Shargel.
Hi, everyone. My name is Ryan Shargel. I'm a board certified periodontist and director of operations for Planet Smilez. And Catherine and I were actually classmates back in Maryland Dental. And that's how I kind of got on board to her passion project. And here we are now kind of expanding. And it's really amazing to be able to talk to everyone today.
Great, Lauren.
Good afternoon. So I'm Dr. Lauren Gritzer. I'm a dental public health specialist. And so I have a DDS and a master's in public health. And then I went on to do a dental public health residency. So I am in charge of advancing the program. So I help write a lot of grants and research papers, and I run the numbers and do the evaluation process for the program. And I met Catherine and Ryan at University of Maryland. We're all University of Maryland DDS alums. Go Maryland. And, I did a lot of work with her on her program and then advocating for ADEA and then American Student Dental Association. And part of my job is my job is being a dental public health advisor and provider in the dean's office at UCSF, which I'm moving very soon for. But thank you. I'm very excited to be here.
Dr. Gritzer is also very active in ADEA on some committees and boards and very active, and so is Lauren and Ryan. So thank you all very much for those brief introductions, and thank you for joining us today. You all have very busy schedules. I appreciate that. All right, well, getting into it. How many of you guys are cleaning up gum underneath your desks in your classrooms, wherever it might be in the school you're in? Students spend over $1 million, $500,000 on chewing gum each year. Which probably isn't surprising. I wonder if that's changing though as students get older and more aware of that. But that's one of our old numbers, and it's kind of crazy. I know I've been in a classroom and I've definitely put my hand under the desk and thought twice about it. So, little fun fact. All right, as we go through today, we have 4 different learning outcomes we want to really focus on. We want to make sure you all recognize who ADEA is and Planet Smilez and how we're here to help and provide support, understand the pathway into the dental education, how to get into the profession, helping your students, what resources are available for students and educators. And we have 3 classroom activities that we're going to go over with you. We have more on our website, but 3 that we want to focus on so you can have some takeaways. We'll also provide you with the link to that website to access all of the teaching materials and product materials, all the different things you might need to be successful. And we think we can accomplish this in the next 45 minutes, which is going to be great. All right, so what is ADEA? Can people put in the chat what they think ADEA is? Have you ever heard of ADEA? Do you think we're the ADA? Do you know the difference between the ADA and ADEA? Let's hear some people in the chat. So the American Dental Education Association, yes. The difference between us and the ADA is that we have the education piece. So our members, like I said, are the dental educators, the dental schools, dental hygiene programs all around the country. There's about 80 dental schools. There's over 350 dental hygiene programs, not to mention some of our other specialties that we have around the US and Canada. We will be providing the slides as well, just FYI, someone's asking that question. And ADEA is the national organization that represents all of that, the whole industry of academic dentistry. We also have an initiative called ADEA Go Dental. I'd love to know if anyone's ever heard of ADEA Go Dental. We're trying to really build that brand. It is our brand for pathway students to come into the profession, to really engage, learn more about the profession and why they should maybe pursue that if they have an interest in the health professions. And we also want to provide a supply of students and professionals, not only to be in the profession, but also to fill our educational experiences and teach in the classroom after they've gone through their dental education, whatever it might be, and come back and really be in the classroom as well. We want to have a diverse representation of people within the health professions for the profession. So no one's saying what they think ADEA is. Okay, fine. Well, I told you, so now you know. So the ADA is for dentists, and they're the ones that put their little ADA on all your dental equipment that they approve, but ADEA does all the education side of it. So awesome. We're going to move over to Planet Smilez, Catherine.
Yeah, so thank you, Curtis. Planet Smilez is a 501c3 nonprofit organization that I founded when I was actually in college, and it's dedicated to creating a comprehensive and immersive learning experience that focuses on essential aspects of oral health, such as prevention, the connection between oral health and systemic health, and providing career pathways in dentistry. We aim to reach children from diverse and underrepresented backgrounds, offering them an inspiring view of what's possible in this field. Our curriculum includes interactive simulation modules, allowing students to apply theoretical knowledge and practical dental-related things that we do on the daily basis. So Planet Smilez provides this dynamic environment where students are actively engaged and participating in interactive sessions and discussions that encourage collaboration and the application of their learning. We emphasize critical thinking and the development of essential skills such as communication, teamwork, and problem solving. Through these experiences, students not only gain a deeper understanding of the dental profession, but also discover the potential impact that they can have as oral health professionals.
Awesome. And Catherine's not going to say this, so I'll say it for her, but she and her team at Planet Smilez also received a really nice grant from Delta Dental to pursue and expand their nonprofit and their experiences. I will say ADEA also received the grant for something else. So we're doing some really good work and we're being recognized. And I want to recognize them for the work they're doing. They're having a huge impact, especially down pathway with some middle and high school students. So awesome. Super happy you guys are partnering with us. So.
Thank you so much, Curtis.
Of course. All right, so how many of you have students that may be considering dentistry, the oral health professions? Tell me in the chat if you want. How many of you guys know how to answer that question? How do I get there? What's the pathway look like? There's some unique things about the dental profession, specifically dentistry. You can have any major you want as an undergrad as long as you're fulfilling the prerequisites, which are organic chemistry, physics, biochemistry, all the things you would consider. You don't have to be pre-med. You could be a dance major. You could be, I have a horticulture degree and look at me now. You never know what you're going to do when you grow up. So really the big things are getting that shadowing experience, community service, getting out there in your community, meeting those that are in the profession. And the great things is that it's 4 years of school after undergrad, and you're a doctor, which is pretty amazing. When I tell students that when I'm at different events like our HOSA events or our different recruitment events, some of them did not realize that you can be a doctor in 4 years. It's pretty rigorous. It's not easy. And there isn't a residency requirement except for in the state of New York. So it's pretty accessible if you can get through that experience. So there's a lot of cool things. The ADEA Go Dental website has a great pathway program, all kinds of resources for advisors and educators. We'll be sharing that with you guys with a post email with all those different resources. But yeah, so if you have a student that's interested in dentistry, there's a lot of options for them. And we find that most of our students determine at the end of high school or early undergrad that they're going to go into the dental profession. So great. All right, so who and what are oral health professionals? I could present these slides, but since we have 3 dentists with us, we're going to just move right along to Dr. Lauren Gritzer and see what she thinks about all these different professions and who's on the dental team.
So who is on the dental team? Well, we have obviously us, the dentist, that's somebody with a DDS or a DMD who is the team leader. So I think one of the things that a lot of people need to recognize that if going into this profession, you need to have leadership skills because you are in charge of all the people who work under you. They all work under your license. So a dentist, we basically diagnose and treat oral health. When someone comes into our chair, we collect their full medical history and their medication history. And we do this because a lot of systemic conditions like diabetes affect oral health. And then a lot of medications have an effect on your oral health. They cause dry mouth, they can cause your gums to flare up. So when somebody comes into our chair, we do an examination, we take x-rays, we read the x-rays, and with that clinical examination, we make up a diagnosis and a treatment plan. And then from there, sometimes if you need a deep cleaning, then our dental hygienist will do that for us. Now, some other people that are on the team are also dental therapists. So dental therapists are actually a new profession. They're only in 13 states at this point, and it's generally in states that have a really large shortage of dentists. So if some of you haven't heard of a dental therapist, that is why. But basically, they're kind of like the nurse practitioner of the field, and they can do restorations and minor extractions, like the less serious extractions. Then we have the dental hygienists. Hygienists are our preventionists. They are the people who obviously clean your teeth, but they also talk to people about oral hygiene, nutrition, and basically having a healthier lifestyle. Then we have dental assistants. Dental assistants help the dentist and the hygienist, and they generally take your medical history and they assist us in all of our procedures. And then, dental assisting and hygiene, they also have expanded functions. So in some states, they can have, and every state varies by like what this expanded function can do. So I'm not going to get into that, but basically, for example, in California, we have an alternative placement dental hygienist, and so they can do non-invasive therapies. So they apply silver diamine fluoride, which is a liquid that can arrest decay. Then we have the dental laboratory technician, which is a key person. They're the people who create basically all the crowns and bridge and the dentures and the partial dentures, very minute detailed work. And then we have the community health worker, and the community health worker is also a role kind of like the therapist that is up and coming, that is becoming more important and predominant in the oral health field. And it's basically to help those who are having issues navigating the health field and having issues, knowing where to get care, coordinating care. A lot of times community health workers work in community health clinics like federally qualified health centers or hospitals, and they generally work with patients that are at high risk, these vulnerable populations that have a lot going on, and they just need kind of like a little bit more help in maintaining their health overall. Next slide. Now, in terms of practice options of being a dentist, there's actually a lot of things that you can do with your dental degree. So you can do academic dentistry or dental education, which is what I do, and Dr. Shargel does as well. Dental research. So you can work for one of the government organizations like the National Institute of Health. At the NIH, we have the National Institute of Dental and Craniofacial Research. You can do international healthcare. I have a lot of friends who do work over in Africa. I know someone who started a dental school in Rwanda, so you can do those types of things. You can go into private practice or work for a direct service organization. And a DSO, a direct service organization, is one of those dental practices like Aspen Dental, Heartland. It's one of the big corporate practices. And then, you have public healthcare policy, which also falls under dental public health. Then you can have your own practice, be self-employed and be a practice owner and manage your practice and have employees. And then you can also do service in the federal government. And actually a lot of these positions in service in the federal government, they have loan repayment. So, a thing with some of these positions and with how expensive it is to, get through dental school, there's public student loan forgiveness. So I think that's something also to consider when, deciding on this path. Next slide, please. All right, I'm going to pass this off to Catherine. She's going to talk about the common traits of dental professionals.
Yeah, so dental professionals usually share a wide range of essential traits. Strong communication skills are vital. As dentists and their teams, we must clearly explain procedures and help patients feel comfortable, especially like me when I work with kids or working with patients who might be anxious. being detail-oriented is equally important as precision is key in dental work. So this could be a really impactful career for students who are very careful and attentive. Analytical skills are necessary for diagnosing and treating a variety of oral health issues. So I like to think that dentists are problem solvers who assess, diagnose, and then develop treatment plans based on their findings. So for students who have these strong analytical abilities, this aspect of dentistry may be particularly appealing for them. Additionally, dentistry combines science with art. So many dental procedures, such as doing fillings or designing a prosthetic, like a denture, for instance, require a really good eye for aesthetics, symmetry, spatial awareness, and making the artistic touch really valuable. Leadership skills are another important quality, as many dentists manage their own practices or lead a team. So good leadership skills help ensure a smoothly run practice and high quality patient care. And lastly, great manual dexterity is crucial, as working in the small, delicate areas of the mouth requires steady hands and precise movements. So students with a passion for activities that involve fine motor skills, like playing instruments or drawing, really could excel in this area. Next slide. So the dental profession offers a wide range of benefits, making it an appealing career choice for students. Curtis, do you mind advancing through? Yes. So dentists are highly valued and respected professionals in society. They have the unique opportunity to build long-term relationships with patients, which can be really incredibly rewarding. Dentistry combines science with creativity and artistry, as practitioners can sculpt and restore smiles. The profession also offers strong job perspectives with a growing demand in the healthcare job market. Dentists often have flexibility in their schedules and allow for a better work-life balance, and there is solid compensation for their expertise. Together, these factors make dentistry a fulfilling and promising career pathway. Next slide. I'm going to have Dr. Gritzer start off here explaining the different dental specialties.
Sure. So right now there are 12 specialties recognized by the American Dental Association, the ADA. And one of the newest ones is dental anesthesiology. And then we have dental public health, which is myself. And as I mentioned, I do have a DDS. I have a master's in public health, and then I went on to do a residency in dental public health. I actually had the master's in public health prior to going to dental school. I was kind of a non-traditional student. I studied biological anthropology and studio fine arts in school. So like I just kind of did my own thing and then discovered I wanted to do dentistry. But you know, what's kind of unique about dental public health is that with most of the specialties, it kind of narrows your scope of practice, where dental public health, it's a huge umbrella. So as I mentioned earlier, it's research, it's policy, it's healthcare administration. There's so many different things. I've done studies on tap water. I've done a community needs assessment for the Wampanoag tribe on Martha's Vineyard, and then created a new delivery model for them so they could get better access to care. My job right now, UCSF, is another model of care. So what we kind of do is we do the research, we test, we get the numbers, and we help to implement and create policy to help improve access to care, and so people have better optimal health. Then we have endodontics, which are your root canal people. And then we have oral maxillofacial pathology. So if there's anything going on in your mouth and you need some type of biopsy, that's the person that you would go to for that. We have oral maxillofacial radiology. So that's basically a radiologist. They read x-rays, CBCTs, MRIs, anything that is kind of like abnormal that the dentist is like, you know what, I'm not really sure about this. Let me like send this on to a specialist. Then we have the surgeons who, those also kind of vary. Sometimes surgeons do, complicated wisdom teeth removal. Sometimes they place implants. Some of them do cleft palate and like are full-on surgeons in the OR and do, shock trauma. So it kind of varies. And then we have oral medicine, and those are for people. We send patients to those people who have complex medical histories. And then orthodontics, as we know, orthodontics are braces and, improving your smile and your bite through bone remodeling. And then we have Catherine, who's a pediatric dentist. So Catherine's going to talk about that.
Yeah, so as a pediatric dentist, I have specialized care in training with working with infants, children, adolescents, and individuals with special healthcare needs, focusing on preventative care, behavior management, and, different treatments that support lifelong oral health. With training in child psychology, we create a comforting environment using techniques to ease anxiety while educating children and parents on good hygiene, diet, and habits that promote dental wellness. We as pediatric dentists also monitor growth, address alignment issues, and work with the orthodontist as needed. We are equipped to handle dental emergencies, as we have training for 2 years in hospital dentistry, and we have the unique needs to work with children with intellectual and developmental disabilities. So I'm going to turn this over to Dr. Shargel to explain his role as a periodontist.
So for periodontics in general, it's more or less the specialty that has to do with the supporting structures of the teeth. So we're really looking at the bone, we're looking at the gums, we're looking at even the ligaments that are within that area that support the teeth. And so my job is essentially to mostly treat gum disease from the standpoint of stability of the teeth. And then in certain cases when we cannot save the tooth or treat the gum condition present, I also remove the teeth and do bone grafting and prepare these areas for future implants that may go in there and restore teeth that may have been lost. And then there's also a component to that, which is almost like a plastic surgery of the mouth, which involves treating gum recession or areas where we have the type of gum that we're not looking for that's not protective for the teeth. So we can use different grafts in that area, whether come from patient or elsewhere, in order to treat those recession areas where the gums may have an issue. Then finally on the list, we have prosthodontics. So that's the specialist that would focus on restoring the mouth. So general dentists can do similar work, but when there's something like a full mouth rehab where many of the teeth are involved with crowns and bridges and potentially prostheses, the prosthodontist is the specialist who deals with that and helps restore the mouth and the bite and make sure that everything is functioning properly. We can go over to the next one here. So this is discussing our craniofacial complex. So we're talking about the structure of the mouth, which is a little bit of what I said here about the gums and the bone forming from childhood through adolescence and into adulthood. And then we really have to focus on the morbidity and mortality because early childhood caries, which is just a fancy name for a cavity, can affect the child and then eventually also affect the adult that they become in the future. So as their teeth develop, and you could see there in our fancy picture under oral development, we have the baby teeth exfoliating there and the new adult teeth coming into place. And so how we treat the kids going into how they become adults will have a big impact on how the teeth come in and then how the wisdom teeth fit. And there's all sorts of things that kind of change through adolescence into adulthood. So here, just a little bit of an oral health background. So we know that the gums protect the base of the tooth and they're a seal for the bacteria. I like to compare it to like a turtleneck sweater. And so that's the gum that's hugging the tooth and it's not allowing bacteria to get under the area of the gum closer to the bone, causing these gum diseases and inflammation such as gingivitis. And so there you see that we have some ligaments in the bone that stabilize the teeth and anchor them. And so we also have some information about saliva. So saliva is very important in the way that it aids in digesting acids and helps prevent decay from occurring all over the mouth. So if there's an imbalance in the saliva, it actually can sort of hinder how stable the tooth is and promote a cavity forming. So we have our primary teeth, which are our baby teeth. They form around 6 months, and then they're replaced by our permanent teeth around 12 years of age. And so taking care of the baby teeth and then eventually the adult teeth is paramount to avoid any issues in the future. So as far as dental checkups, we do them every 6 months and we take accompanying x-rays. After we have already seen a patient, we decide what their relative risk is for cavities and other potential diseases. And then we may have them come in sooner than 6 months as well. And then for children, they might be x-rays with a cleaning as well as fluoride treatment. We can go on to the next slide. So just quickly about dental anatomy. So the outermost layer of the tooth is enamel, which most people are familiar with. Then the middle layer is the dentin. And then finally we have the pulp. So the outside layer is the really hard enamel that protects the tooth and prevents any kind of bacteria from getting into it. Then the dentin is a little bit softer and has the vascularity of the tooth that essentially keeps the tooth alive. Most people kind of don't relate living with the tooth, but our teeth are actually living structures. And we know that because once we have a cavity or something that goes into the pulp of the tooth and affects the nerve of the tooth actually dies and we consider it non-vital anymore. So teeth are actually living tissues. So this is just a nice schematic showing the 3 different layers here and then the pulp of the tooth as well. So the oral microbiome. So in general, microbiome is just a really fancy word for a collection of different bacteria that form and that exist in the mouth. So in the mouth, we have millions of different bacteria, most of which are good, some of which are bad, but the good sort of outweigh the bad. And that's how we have symbiosis. So we can see that healthy microbiome is a healthy mouth. So as that balance shifts from health to disease, we go from symbiosis to dysbiosis. So again, it's just a fancy word that's just saying that the bad bacteria are now in a much larger number where they're now ahead of the good bacteria. We can't really get rid of all the bacteria and we need them to keep the health in the mouth. So we're just trying to keep that balance, that scale tipped a little bit towards the good bacteria and a little less favored towards that way instead of the bad bacteria. And then once there's an imbalance of this bad versus good, then you can promote gum diseases such as gingivitis, you can promote caries formation, and you can have other issues systemically as well if this bacteria balance is kind of tipped towards the bad bacteria. So going on to here, we have the link between oral health and systemic health. So the reason why periodontal disease is such a big topic is because in recent years, they've been linking it to so many systemic disorders. So periodontal disease is pretty rampant here in this country. And so as we see those patients, we tend to see that they come with either a complex medical history or they come with comorbid conditions such as diabetes and heart disease and respiratory illnesses. And in certain situations now, they're putting out some research about different adverse pregnancy outcomes as well with short-term births and babies that are weighing a little bit less than they need to, and they've now linked those specifically to periodontal disease. And so that's become a big topic of treatment for many different patients, because if you can actually clean up the gum disease, you'll see that the other conditions start to get better as well. Then as far as head and neck cancers, so you can see that smoking and chewing tobacco are the most common. They cause the most head and neck cancers. And then there's also the HPV that's transmitted at a very high rate that can also increase cancers occurring. And then in general, as a whole, pregnancy is a big thing where I have many patients that come in who are pregnant, doesn't matter which trimester they're in, but they're more predisposed to inflammation and potentially having gum issues. And so we have to be extra diligent with those patients to make sure that they don't kind of let the gum disease go out of control and eventually develop something like periodontitis, and then it just sort of cascades from there to other systemic diseases that may occur. So here, just to sort of reiterate what we said before, it's not one thing or even two things that really lead to a cavity formation. It's the combination of everything. So sometimes you can see people with poor oral hygiene, but their diet is pretty good and they don't collect much bacterial plaque. They may not get a cavity. And then you see someone else with great oral hygiene and not that much bacterial plaque, but their diet is very acidic. And just from their diet alone, that can cause cavities to form. So it's kind of a multifactorial process that leads to a cavity being formed in this area. And so we need to kind of be preventative in every measure possible to avoid that from occurring.
Dental cavities, or caries, is one of the most common of all disorders. It is an infection caused by a combination of carbohydrate-containing foods and bacteria that live in our mouths. When these bacteria find carbohydrates, they consume them to produce acids. The acids demineralize the hard part of the tooth, enamel and dentin, and eventually reach the pulp chamber. The bacteria are contained in a film called plaque. Plaque begins to accumulate on the teeth within 20 minutes after eating. If the plaque is not removed thoroughly and routinely, tooth decay will occur. Treatment of a cavity generally consists of 2 steps. Removing the decayed portion of the tooth. Under local anesthesia, a high-speed dental drill is used to remove the decay and prepare the tooth for the filling, rebuilding the missing tooth structure with a suitable filling material.
Alrighty, so that was a little description of how the cavity forms and then ultimately how it's treated as well. And then on the next slide, we're going to go into a little bit of the Smiles in the classroom, the hands-on activities that we have. And I'll be talking about the first one, which is indirect vision. So as the word kind of says, it's indirect. So you're not looking straight at something. You're actually using a mirror to indirectly visualize a specific tooth or an area of the mouth, depending on what the goal of the treatment is, or even if you're diagnosing whether it be cavities or gum disease, you can actually visualize certain areas of the mouth because, as we know, the mouth is not that large and not easy to see. So the mirror helps us accurately diagnose and treat our patients. It gives us access to certain areas where you can actually use your drill looking through the mirror and indirectly prepare a tooth, which normally would be very tough to do without a mirror, or you would have to compromise a lot of your neck and back muscles there long term. And so it also reduces the risk of injury because it lets us be more accurate. It lets us look through the mirror and treat the accompanying tooth or jawbone, whatever it may be, in order to kind of stay away from teeth and cheeks and everything else that could be nicked with our instruments or our hand pieces, which can cause serious damage there. And here on the next slide, we have an example of this direct vision. This activity. So there you could see that the student was using a mirror to go ahead and color in those photos. She was kind of making it look pretty effortless, but I believe if everyone tried it on their own, it's actually not that easy the first couple of times you do it. And here we just have a maze with the tooth where the students can use a mirror, put the sheet of paper down with the maze on it, look through the mirror and try to actually trace the marker through the entire maze while only looking through the mirror. And the next slide, we'll have Catherine go over her module.
So I'm going over this module, but I will say indirect vision, it definitely is something to get used to. So I'm going to be talking about the sugar coat module, and I'm going to be talking about, sugar, oral hygiene, things that we think kind of complement this, and facts and items that we think that, should be included in this module. So number 1, toothbrushing. So just some facts about toothbrushing or some information is you always want to use a soft bristle toothbrush. Frankly, I don't even know why they sell medium or hard bristle brushes, because those types of brushes will cause your gums to recede, especially if you, even with a soft bristle, if you brush too hard. Toothbrushes should not be shared ever. And that goes back to this bacteria in the mouth, and then specifically the bacteria that causes cavities, Streptococcus mutans. One of the reasons why we promote oral health during pregnancy so much is we want the mother, when she has the child, to be disease-free so that she doesn't pass that big bacteria from mother to child. And then we are also finding now in daycare that children are passing the Streptococcus mutans to each other. So, we definitely don't want to be sharing toothbrushes. And on top of that, like spoons, cups, those types of things. You always want to store a toothbrush in an upright position after use, so it properly dries and doesn't get like mildewy. You also want to replace your toothbrush every 3 to 4 months. And so when I was an oral health educator, I would tell the kids like every time you get your report card, essentially. And or also you'll always want to replace it when you've been sick, because that's full of the bacteria or the virus that you've just gotten over. There have also been a lot of studies on this topic of manual versus powered toothbrushes, and they have the same effectiveness. It's honestly how well you use it and how much you're kind of like paying attention and making sure you're getting all the spots and doing all the angles and those sorts of things. And then obviously we always want to be using fluoridated toothpaste. I love fluoride. I'm going to talk about it a little bit later, but fluoride really helps to strengthen your teeth, and it also helps to reverse when your teeth start to break down from decay. Yes. So, and also when we're talking about toothpaste, you always want to buy a toothpaste with the American Dental Association symbol on it, the ADA symbol. That means that toothpaste does have fluoride in it. The ADA actually is a very stringent process for a product to get their label on it. You have to have a very strong clinical trial and show at least, I think it's at least 80% efficacy. So this is something we always guide our patients. Always, you can trust something with the ADA symbol on it. Next slide, please. All right. So moving on to flossing. So we're flossing once a day. We're flossing at night before we brush our teeth. You generally want to break off about 18 inches of floss, and then you want to wrap it around your middle finger and then use your thumbs and your index fingers for stability. You want to basically glide the floss on the side of the teeth. We're not just going like up and down. We're going sliding along the side of the teeth and up under the gum, but we're not doing it hard because that can cause trauma. And so you're doing that on either side of the tooth, and you're doing that, yeah, not hard, not traumatic. I definitely have had patients who have gum recession, and I ask them, and they're like, oh, I floss like multiple times a day. Don't floss multiple times a day, but also just be aware that when you do start flossing, if you're not good, your gums will bleed, because you do have a bacterial load. The gums are usually inflamed and irritated, so that is expected to happen. But then obviously if you get into the habit of doing it, it'll slow down and you will not bleed as much. Okay. All right, so fluoride. Fluoride comes in many different forms. We're exposed to fluoride in many different ways. So one of the biggest ways we're exposed to fluoride is when the dentist applies it at the office, and that is a very concentrated, kind of like sticky material. And it's especially beneficial for young children and individuals who are high at risk for cavities. And then it also provides additional protection between regular cleanings. We also have our fluoridated toothpaste that I was just talking to about. The other thing is, besides strengthening tooth enamel and preventing decay, it also, how it kind of works is it reduces acid production from bacteria in the plaque, and it actually causes some of these cells to burst. It causes what we call apoptosis. So it's most effective when you're using it twice a day for 2 minutes. So that's another thing. We want to be brushing our teeth for 2 minutes, 2 times a day. And it's also available in various strengths. So as I said, there is the ADA approved, the over-the-counter. But then for kids that are really high risk, or for patients that are high risk, there is a prescription strength toothpaste called Prevident. And so your doctor or your dentist would write a prescription for that, and you can get it at the pharmacy. Another way to be exposed to fluoride is obviously through community water fluoridation. And right now, there's so much misinformation in the news. It like drives me so crazy. I saw somebody's question come up about, I think RFK, I think might have to do with fluoride. That man, I'm okay. If they stop putting fluoride in the water, it's going to keep dentists in business. Like it's, but, they actually came out, in Calgary, they stopped fluoridating their water for a certain period of time, and they've already found that decay has gone up by 700%. Emergency room utilization has significantly increased. So, I mean, there's so many studies out there that show just the efficacy of water fluoridation. It's safe, it's cost effective. It's one of the most, it's recognized by the CDC as one of the top public health achievements. Generally when you're seeing these studies that, oh, it's a neurotoxin, it's this, it's that that's usually when the level of fluoride in the water is above the optimal level. It's, the optimal level for water fluoridation is 0.7 parts per million, which is the equivalent of 7 milligrams per liter. And when you're reading about like this neurotoxin, it's like, oh, it's 1.5 or it's something very high. And obviously anything that is too much of is bad for you, like vitamin D, vitamin A, vitamin E. I mean, anything too much is bad. So that's kind of my I'm gonna get off my soapbox now about fluoride, but that is kind of the gist with that. And also there's mouthwash that you can use. You want to use it though prior to brushing your teeth. And the reason why I say that is the concentration of fluoride in mouthwash is significantly lower than what's in the toothpaste. So essentially, if you brush your teeth and then you use mouthwash, you're rinsing off all that higher concentration of fluoride off of your teeth. So if you're going to use mouthwash, use it before.
Lauren,
Right.
all I know is I got a cleaning last week and the flavor options for fluoride were crazy. I got caramel and it was delicious. Or caramel.
Yeah, they have like caramel, pina colada, bubble. I mean, you name it, they have, yeah. But it's still, it's like, yeah, I don't know if this really is good flavor.
Right.
All right, so just some nutrition takeaways. Obviously, we're trying not to eat processed food or sugary foods. We want to try and eat probiotic foods. So like yogurt and cheese, they're very beneficial. And there's actually lactobacilli. It's that helps to support the microbiome and keep it balanced. And actually it raises the pH. So part of the reason why we do get decay in the mouth is when we eat and when we eat sugar and acidic foods, the pH in our mouth drops. And so it basically, your pH has to drop to 5.5 for decay to start. And one of the reasons actually why I love fluoride is fluoride basically makes it so that your pH in your mouth has to drop to 4.5 for the tooth to start breaking down. So that's why when we're talking about that, it makes the tooth stronger. It's because of that. We also want to obviously always be drinking water, preferably fluoridated tap water. And we want to try and stick away from sugary drinks. So sugary drinks, not only are they acidic, but then sugar. And the sugar feeds the bacteria, and then the bacteria produces the acid that breaks down your teeth. So next slide. All right. So for our activity, it does revolve around sugar sweetened beverages. One thing that I will say, the worst drink that for you to have are energy drinks. 2012 is when energy drinks became really popular. And that's when decay started to spike. It literally just like shot up. So not only is it very acidic, it has a lot of sugar. Same with Coca-Cola, chocolate milk, Fanta, and sports drinks. Also, I feel like a lot of people don't recognize that sports drinks have a lot of sugar. So our activity is to basically have the kids count out sugar packets. And I think it's kind of an easy, non-messy thing to do. And they can actually really see how much sugar they're putting in their body. Like 1/16 ounce thing of like ginger ale or Gatorade. I mean, we're talking about 65 grams of sugar essentially. So that's our activity for that. And I think that would be, fun, beneficial for them to really reflect and realize just how much sugar they are consuming, and that drinking water is always the best route to go. So passing it on to Catherine.
I did this with my nutritionist, and it's amazing how much we drink for sugar too sometimes.
Mm-hmm.
It was interesting.
Mm-hmm.
All right.
Hi, so I'm going to go into our soap carving module. And this really demonstrates like the artistry in dentistry. So we're going to hop to the next slide. And, soap carving is a hands-on activity that enhances students' understanding of various scientific principles relevant to dentistry. So in dental anatomy, it can help students learn about the structure of the tooth shapes and certainly their functions. Through the physics of force and motion, the carving teaches the application of pressure, force, angles, and motion, providing a tactile understanding of these concepts. The activity also fosters problem solving and critical thinking as students plan their carving approach and adjust methods, an exercise that can mirror the scientific method. So the soap carving demonstrates real-world application by linking anatomy and science to the practical skills and how this is relevant in dentistry. So as we hop to the next slide, we will see that it's designed to help participants develop essential skills beneficial in healthcare and certainly dentistry. Through the hands-on exercise, individuals can improve their hand-eye coordination, allowing them to perform intricate tasks by synchronizing visual input with precise hand movements. It can enhance dexterity, familiarity with different tools, and building that comfort in handling instruments necessary for detailed work that we do as dentists. So carving fosters the three-dimensional visualization that helps participants to mentally visualize shapes and structures, which is crucial for spatial awareness. This is one specific part of our dental admissions exam where they test you on spatial awareness, which is interesting. So getting back to the activity, it promotes attention to detail, encouraging meticulous and accurate approach to tasks, while also inspiring a sense of aesthetics, leading to the creation of a visually appealing work. So as we can look here, this is actually a dental student in a video. Dental students are loving making TikToks of themselves. So I found this one that shows them doing a soap carving. And actually at some dental schools, not at my school or Ryan or Lauren, but some schools actually have this be part of their interview per se, where they have to carve soap. So it's interesting. As we go to the next slide, this is also on the website, but it could be like a stencil. So they could print this out, cut it out, and trace this on their soap. And so that's how they can carve. For the next slide, this is not of a tooth per se, but I found this on YouTube and it shows like the different, tools that can be used for the soap carving, such as like a plastic knife. You can use a paper clip. You can use a pencil to outline things. So in this video, they're showing how someone is carving an elephant from soap. So for this, these I think are, materials that you might have already in your classrooms. And as we go to the next slide, something that you can find on the website as well is actually a handout that we made, the Smiles in the Classroom handout, which covers essential topics on oral health. I was thinking that this maybe could be like a nice handout to the students to give out during Children's Dental Health Month, which is in February, just as a reminder for key oral health messages.
I would just have one thing to say. I don't know when you guys grew up, but I grew up with special soap, like don't touch that soap or use that soap in my mom's bathroom that was for the guests. So make sure your students don't take that to classrooms with them. So very cool. Well, thank you all very much. This is super great. I did share the link to the website, which also has the lesson plans and the material list. There's 5 total on the website. We only went through 3 today, but there's some great things, and we'll be adding to that. This is kind of our first of hopefully many new things we're going to be doing. So as we kind of wrap things up, I just want to make sure everyone knows that ADEA does a free in-person event every March. This year it's March 8th. It's at National Harbor, which is literally DC, but not DC. It's for anyone in high school or undergrad that's interested in the dental profession. We typically have almost all dental schools from the North America there. And so we really encourage them to come. We have great talks around finance and different things, different profession pathways, and also preparing for the application, which is really why students go, as the DA manages the application process for all dental schools, except for in Canada, except for in Texas. So, all right.
Okay, there's a few questions. If we could, oh, the dental therapist. Oh, well, there you go. Few questions. The dental therapist, that was brand new for me to hear about. I think you said they get certified or licensed in 13 states. Is that what you said?
Yes. So it's a very new field. It was started actually in Minnesota. Minnesota is actually kind of the leader in dental public health and innovation. And dental therapy, it kind of varies about to the program. Some programs you do need a 4-year dental hygiene degree. There are some dental schools like Maryland that do offer that. Then there's some programs that it's sufficient if you have the dental hygiene associate's degree. And then some programs, they offer the full degree. So you'll get the undergraduate hygiene, and then you can go on and get the master's degree in dental therapy.
Okay. And then there was another question. Oh, about dental lab technicians. Are they in less demand now? As I know, some dental practices purchase their own equipment and technology for making crowns and whatnot. So I didn't know whether that profession was flattening out some.
Yes, it is actually. There's less demand and not as many people are going into that just for that very reason. However, prosthodontists, the people who do the really complex cases, they still do use labs. So for the really complex cases, I think dentists still will use the lab, but if it's just, kind of like your standard crown, a lot of dentists do have milling machines now, which I think also patients kind of prefer because the turnaround time can be almost, can be hours. So
Is it commonplace across America that dental practices are closed on Fridays or half days off on Fridays?
I mean, I don't think so. I think, dentistry is changing a lot. Dentistry, I mean, there is flexibility, but, dentists are working more and more now just because the insurance reimbursement rates are so poor. So we are definitely being hit by that. The overhead of a dental office is incredibly high. You can expect in a dental office, the overhead to be probably 60%. And so, dentists are trying to figure out ways. I think, the thing with the dental therapists, the ADA is now just, the American Dental Association is now just starting to kind of support dental therapists. But for a while, they're like, oh, well, this is, kind of taking the place of the dentist. But in reality, they've done all these studies where, dental therapists in a private practice, the dentists are actually making more money because the dental therapists can do these less complicated procedures, these fillings, these less complicated restorations, and it leaves time for the dentist to do more complex like crown and bridge, for example. So, and also it makes it so that, more patients can be seen. So I think it's kind of like a win-win.
Oh, that's interesting because, initially physician's assistant, it was a little, maybe physicians weren't as welcoming, but hopefully, in the dental practice field, maybe there'll be some advantages that you talked about. Okay, why are wisdom teeth called wisdom teeth? Nobody knows.
Catherine, you want to take this?
I don't know the answer. Do you know the
I
answer?
know.
I was
I
thinking
think-
about that. I'm like, we had to learn some tidbit about that.
I
But
know. I just thought maybe it was some legend that y'all got in school that you could share with us. And then in one of the videos we had I think it's recently past Halloween, and somebody wanted to know, was that a Tootsie Roll in that video where you were showing us about the cavity? It looked like a Tootsie
I
Roll.
hope it was a Tootsie Roll because the alternative is not pretty. So
Yeah, I agree. That was one that I had found on YouTube. It was really hard to find one that was really short and showed you all of the information, but it looked to be some type of candy for sure.
Yeah, I think you've already spoke to RFK Jr.'s fluoride comment. And then there was a question, is there a pathway available for dental assistants who are interested in becoming hygienists without repetitive courses, long wait list?
I
Can
would
their
say,
experience-
I'm happy
Okay,
to
go ahead.
speak on it, but I would say every single dental hygiene program is unique and different. So it's really going to depend on where you are regionally and what programs you're looking at. I would say most dental hygiene programs that we work with, they're smaller, they're more regional. People aren't traveling like they do for dental school to, across the country. So it's more regional. So they typically would work with those within their region. I know whenever I go to Texas, every high school student I meet that's interested in the profession is already a dental assistant, which is amazing. Certain states just have a really great high school program. I think that it helps them get maybe into those programs, but there may be a little bit of redundancy because they haven't quite aligned quite yet. So.
But they would have a competitive edge on their students, probably, or other students perhaps, on their application. If they were already a dental assistant, then it appears that they were serious about this for a while. And also they've touched a patient and that kind of thing. There was a question about Gardasil protecting against HPV 16. Does that mean anything to you all?
It does. So Gardasil 16, those are the 16 most like serious strains. So it protects against oral pharyngeal cancer, cervical cancer, like genital warts, like things like that. So the things that have the most serious health consequences are in the Gardasil 16.
Yeah, so I actually shared the CDC link with you all in the chat. So Gardasil is a vaccine that protects against 9 strains, strains 6, 11, 16, 18, 31, 33, 45, 52, and 58. So it is effective for sure.
Okay.
Well, there's no other
let's-
questions. I wanted to just thank Dr. Pollack, Dr. Gritzer, and of course, Dr. Shargel for coming and providing us their wisdom, and also to Nancy and the team over at the National Consortium. Really excited that we got to do this. This is our first time. We hope to do this many, many more times and engage with the community. So
Well, I'll tell you what we can do as well as we'll put this. I'm gonna start recording because no one needs to hear all this.